Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello, welcome back to Dr. Jeff Talks About Sex and Intimacy. I'm Dr. Jeff Albaugh, and I am really glad that you're here with us. Today we're diving into an important and often overlooked conversation about what it means to reconnect with intimacy, identity, and relationships after military service. Today, you are joining us for episode 64. That's amazing. Sexuality after service, reclaiming intimacy, identity, and connection as a veteran. So whether you're watching live or listening to the recording of the podcast later, every moment of your amazing life counts. And I personally count it a true blessing and a gift to have you here joining us to improve your life. So I sincerely thank you because you are exactly what this podcast is all about, definitely. Well, we're connected across so many platforms. We are on Facebook, we're on YouTube, we're on LinkedIn, we're on X. We're on everything. If you are on X and you want to submit a question, please hop over to one of the other platforms so you can communicate with us directly. And a quick favor, if you are a Facebook person, please follow us, because the more people who follow us, the more we can do on Facebook. We truly appreciate our followers. So visit us on the website. Gosh, we have 63 previous episodes, and this one will be on here later tonight. So lots of great episodes with amazing guests to learn more about sex and intimacy. You can go to the calendar, pull it up, see what's coming up all the way through the end of May and beginning of June. You can see what's on the calendar and join us. We are definitely streaming with you. So we're going where you go, wherever you go, in the car, whether you're in the car, whether you're working out, whatever you're doing, we can be there with you. We love to work out with you. Take Dr. Jeff Talks About Sex and Intimacy with you. We are on iHeartRadio. We're on Spotify, on your favorite streaming service. Let us join you. As I always do at this time, I would like to remind you that, as always, you listener, you are so welcome here. Whatever your sexual orientation, whatever your gender identity or your relationship style, this is a space for everyone, you included. So I hope you feel welcomed. The mission of the podcast is simple: to empower and enlighten you with the evidence-based scientific information that improves sexual health and deepens your amazing relationships with others, so you can live your one miraculous, wholehearted life with more love. That's basically our mission. Today's episode, we're going to explore more deeply an important and often under-discussed topic. So what happens to sexuality, identity, and connection after military service? Well, for many veterans, the transition to civilian life can bring profound shifts, not only in routine and purpose, but also in how they experience intimacy, relationships, and their own sense of their self. Service can shape the body, the mind, and the nervous system in lasting ways. Experiences of trauma, of injury, separation, and then reintegration can all influence how safe, connected, and present someone feels, especially in intimate moments. And yet, these challenges are rarely talked about openly. Well, that's what this show is all about. In this episode, Sexuality After Service, Reclaiming Intimacy, Identity, and Connection as a Veteran, we're going to help veterans and their partners navigate this deeply personal experience. Together, My guest, we're joined with Asya Brodsky, a skilled clinician and certified sex therapist, and she's going to help us with this great topic. Asya and I have worked together at the Jesse Brown VA, and she is amazing, one of my favorite people. And I'm really happy to introduce you to her soon. So, whether you're a veteran, or you love someone who has served, or work in healthcare, this conversation offers insight. It offers compassion and hope. So, Asya L. Brodsky is a licensed clinical social worker. She's a certified alcohol and drug counselor, and she is a certified sex therapist with extensive experience supporting individuals and couples navigating complex intersections of trauma, identity, and intimacy. She's dedicated much of her clinical work to serving veterans, helping them address the unique psychological and relational impacts of military service, including post-traumatic stress, substance use, reintegration challenges, and changes in sexual health and functioning. Asya brings a trauma-informed, sex-positive, and deeply compassionate approach to her work. She creates a safe space for clients to explore vulnerability, rebuild trust, and reconnect with themselves and their partners. Her integrative style combines evidence-based therapies with a nuanced understanding of the cultural and emotional landscape of military life. Through her work, she empowers veterans and their loved ones to move beyond survival towards meaningful connection, pleasure, and wholeness. I could not be more excited to welcome my friend, colleague, and guest, Asya Brodsky. Welcome, Asya.
Thank you so much, Jeff, for having me. This is an honor. It's really fun to talk about a topic that is near and dear to what we do every day, and to help veterans kind of understand that they can surpass and heal, improve, and feel satisfied with their sexual experiences.
Definitely. I am so excited. I can't wait to hear what you have to say. So I'm going to turn it over to you. It's all you now, Asya.
Awesome. Thank you so much. Thank you, audience members, for being here and for listening. Like Dr. Jeff said, I'm a sex therapist. And the thing that I want to talk about today with veterans is going to be highlighted by a quote. And I'm going to quote someone named Mitch Tepper, who is a ASEX certified sexuality counselor. He's a disability advocate, and he's done a lot of work with the veteran population. And I think in reference to our talk today, and the title of our talk being Sexuality After Service, Reclaiming Intimacy, Identity, and Connection, I think it fits very nicely into the conversation. So what Mitch's quote directly from his thesis is, "The secret to great sex lies more in the state of your mind than in the state of your body, in the feeling in your heart more than in the feeling in your genitals, and in the quality of the connection more than in the quality of the erection." And I say that to say, because a lot of veterans, and I will say a lot of the research that's been done is on military veterans, combat veterans, specifically males who've been deployed. And they may come back with military wounds, whether they're visible or not. And a lot will come back, and if a clinician or if anyone even touches the conversation of sex, it's usually about physiology and physical functioning, and not about fulfillment and satisfaction, which is where the work of a sex therapist lies. It's focusing on what can we do to improve a veteran's sexual satisfaction, fulfillment, and joy, versus whether or not we can fix the mechanics, which may or may not be alterable after a deployment or after active military duty. So I'll talk a little bit generally about the military culture, and how that can sometimes, while helpful in battle, play a detrimental effect when it comes to the bedroom and a sexual experience. So the warrior ethos, when someone goes into combat, whether, and not necessarily even when if they're deployed, they could be members of the guard, but awaiting deployment or not, even in boot camp. The warrior ethos promotes virtues of invincibility and fearlessness and ruthlessness, stoicism, confidence, sort of defendedness, guardedness. And part of it is to be able to survive, to be able to withstand military service. And this aligns generally with very traditional roles, so it aligns well with, male identified people feeling like they can fulfill their role identification by presenting a certain way and using it to their advantage when serving. Interestingly, also, a lot of people, when they enter in the service, they enter during reproductive, adolescent, older adolescent age. So it's a developmental stage that's focused on intimacy, and they're going into the service right around this time. So this battle mind training, it promotes mental toughness, and while absolutely critical and vital, perhaps for survival and withstanding combat, deployment, operations, it sometimes teaches to cut emotions off, and that makes it tougher to connect sexually, because if there's something we know about sexuality, it's that it's certainly much more extensive than physiology, and it goes beyond connecting on a physical level and needing safety and trust to be able to connect on an emotional level. And when someone is cut off from their emotions, it's much harder to connect that way. So we help people sort of work through the internalization of emotion, work through the defensiveness against emotion, and learning to embrace it instead of fighting it, no pun intended. And so some people may have heard of, sexual response cycles. I know, Masters and Johnson, their model was promoted by Masters of Sex on HBO, so people may have heard of it. The key that I want to emphasize here is that the way we truly believe sexuality works is in a non-linear fashion. So unlike the sexual response cycle that talks about, excitement, plateau, orgasm, resolution, going up and then, ending in this climactic way, we see that that doesn't always come to be. And oftentimes when individuals feel like one of those stages is missing, they, famous sex therapist Barry McCarthy says, when, if one of those elements doesn't work, between all or nothing, usually nothing wins, because if someone feels like they can't reach all of the stages, they might as well, throw in the towel and forget about all of it. And that's actually not true at all. And it's very harmful and detrimental. So what we want to do is we want to encourage people to engage sexually however they can, expand their sexual repertoire. And very much this applies to veteran populations, especially when veterans may have, spinal cord injuries, genital injuries, orthopedic injuries, amputations, burns, things that, combat related physical injuries. Studies show they're 3 times more likely to experience erectile dysfunction, which obviously creates problems in engaging in sexual activity, but it doesn't mean that sexual activity should be off the table. It means we have to engage creatively, change positioning, look at what can we do when it comes to body sensation. If there's diminished sensation, what can we do that can promote that? Maybe include other areas, like Mitch Tepper says, look, your brain is your biggest erogenous zone. It is not your penis. It is not your vagina. It is not your genital area. It is your brain. So use that, be creative in engaging it intimately so that you can increase your own sexual confidence and sexual experience. So the things that I want to, talk about is, like I already mentioned, most people who, if they even address sexuality, if veterans even address sexuality, they usually wait for providers to bring this up. And this is such a loss, because providers think they're not going to bring it up. They're going to wait for the veteran to bring it up, and the veteran doesn't. And it really is a missed opportunity. So fear of bringing it up, fear of offending is something that creates a significant barrier to talking about sex. Discomfort, feeling like there isn't enough time, feeling like they're going to embarrass themselves, they might negatively impact the relationship. Again, fear of offending providers, and then also the sense of this is taboo. I don't talk about this. Again, the warrior ethos is I don't talk about my feelings, let alone talking about sexual experiences. But what we find is that not only is it incredibly beneficial, but veterans' lives are enhanced when they're able to talk about sexuality. We also know, that after combat, usually there's, specifically after combat and deployment, there's higher rates of PTSD with the veteran population. If you look at different symptoms of PTSD, all of these can affect sexual functioning. Again, when it's numbing or flashbacks, being able to be present within one's mind without being taken over to another place obviously will impact someone's sexual experience. Military sexual trauma, unfortunately, is also a common factor in the military. So that can contribute to loss of pleasure, loss of interest in sexuality. So it's about finding creative ways to kind of get past that. So Mitch Tepper, who again I mentioned earlier, did research, and one of the things that he found, and I think this really is so important, is he has this whole graph. He's written a book, but he has this whole chart on sexual response after injury. And what he's found after speaking to military couples, individuals who have been affected by visible and invisible wounds from serving in the military, is that trust, safety, and connectedness transcends physical and genital loss. So, connectedness and intimacy with a trusted partner not only allows for peak sexual experiences, but it is the pathway to experiences of pleasure and orgasm. Some of you may have heard of Emily Nagoski, who has several TED Talks. She's written books. One of her most famous books is Come As You Are. But one of the things that she talks about that I think is very applicable to veterans is that pleasure is the measure. So focusing on pleasure, not necessarily I need to behave this way or I need to behave the way that I used to behave before I went to the military. Again, circumstances change. Circumstances are different. Sexuality changes throughout the lifespan. And military service certainly is a significant influence on the way someone's body behaves, someone's mind behaves. So we have to maintain realistic expectations. We can't expect ourselves to behave the way we did at a certain point in time, especially if there's been a critical shift in the way someone functions. So I mentioned again the Masters and Johnson, the initial linear cycle that we're moving away from. So moving away from those performance-based and genitally focused concepts of pleasure to expand the repertoire to say, look, how can we connect? How can we explore ways to do that? I will sometimes have couples do basic exercises like lying in the grass, and what does it feel like to touch grass in the summertime and lie down? Or what does it feel like to lie down on snow and make a snow angel? Or what is it like when you're taking a shower? What does it feel like when the water touches parts of your body? When you're cleaning your body, do you wash over certain areas very quickly? Is there a sense of shame or embarrassment or discomfort? Same with looking in the mirror. One of the exercises I do is take a mirror and look at your body. Look at your body. What does it feel like? What do you connect with? Where does your mind go? And explore that. Invite that conversation, because when we, again, I also tell patients the scariest closets are the ones that are in the dark. When we turn on the lights, they're not so scary anymore. Because when we avoid and we don't face our fears, things seem a lot more overwhelming. But when we actually embrace it and say, okay, this is me, this is who I am, this is how I am now in this stage, in this point of my life, then we're all the better for it, and we can actually move toward joy and away from shame and pathology and negative thoughts and negative feelings and negative experiences. So the absence of genital distraction, the focus on non-genital sensation, facilitates the emotional element of sexual experience, right? So we're not, instead of being preoccupied with my penis used to do this, I used to be able to orgasm in 5 minutes or whatever. When we move away from certain markers, then we can say, I am present, I'm here, I am able to enjoy this. I also, when when I talk about orgasm and describe it, I will say it is truly the ability to, whether being with oneself or being with somebody else, to be able to fall apart psychologically, emotionally, and trust that you can be put back together. And so it's a very vulnerable experience. Again, for many veterans, this is a very, very scary thing. So the way we start doing that is, first we move towards connecting to emotional experience, because I really do believe that sex and sexual connection is very emotional. So moving away from measures, moving away from that and connecting to what does it feel like? Think about, when am I able to be myself? When am I not distracted? When am I not preoccupied? When am I uninhibited? And translating that into the sexual realm, sort of being with one's body. Sometimes I'll recommend people do things like body scans, as you're walking, feel your feet touching the ground, and then go up the rest of your body. What do your legs feel like? Can you feel your joints? Going up. What does your genital area feel like? What about your hips as you're moving around? Now to your back. Where do you have pain, right? Basic body scans. Assess your environment. Do you need to change when we talk about, sensate focus is a kind of a known sex therapy intervention. All sensate focus is mindful awareness around sexual experience, whether it's alone or with a partner. But do we need to change the temperature? Do we need to change the pressure of something? Do we need to change the light? Do we need to change the location, the environment, right? To help facilitate embodiment, being present with oneself, being present with one's partner. I'll also, sometimes I'll do exercises with couples, and I'll have them touch hands, and I'll have one person touch the other person's hand. And if the person who is receiving is preoccupied with, oh, my hands are rough, I need lotion, da 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 da, the person who's doing the touching can sense all that. And I tell veterans and couples the same thing. Notice that the person you're with can feel whether or not you're with it and in the moment or not. So that's really important. Again, when we think about aids and ways to treat sexual difficulties for veterans and also the general population, we think about, do we need aids? Do we need lubricant? Do we need water-based lubricant that helps? Do we need hormone creams? Menopause, andropause, all kinds of things affect our sexuality over life. So do we need certain creams? Do we need vibrators? Do we need adapters? There's a book written, and I will mention it in just a second, but there is a book written specifically for wounded veterans. It is called Sex and Intimacy for Wounded Veterans, A Guide for Embracing Change. And in that book, it literally has pictures, and it talks about different adaptive ways to engage in sexual activity when a veteran has been injured physically. What do we need to do to help with that? And there's all kinds of stuff available now. You can use regular pillows. You can use wedges. You can use different, in today's world, I've seen kids' couches that can come up and down. They can be used. I've seen pregnancy pillows used. All kinds of things can be used to assist. And then obviously there's more intensive interventions. There's vacuum pumps. There's reconstructive surgery. Again, there's all kinds of things. There's medications. There's all kinds of things that can help. But again, for me as a therapist, I'm a social worker, sex therapy is my primary mode of treatment, helping veterans address, how do we lower performance anxiety? How do we improve communication? How do we talk about safer practices? How do we talk about changes in the body so that we can embrace what we do have instead of focusing on what we don't? So, again, I talk about the goal of the work when it comes to veterans, when it comes to veterans and their partners, is the goal should always be based on prioritizing intimacy and behavior if that is what someone wants to do. Again, some people will say, no, that's not a priority for me. Then fine. But we want to normalize the experience that they're having, and we want to prioritize fulfillment and satisfaction. Again, Barry McCarthy, who I mentioned before, a famous sex therapist, says There's no right way to be sexual. Non-demand sexual pleasuring, again, the ultimate focus is satisfaction so that individuals can feel happy and content in the sexual experience that they have. The quote and the book that are the thesis that I'm mentioning by Dr. Mitch Tepper is the book is called Regain That Feeling: Secrets to Sexual Self-Discovery. And again, he also has I will mention a documentary, a very wonderful documentary that I've had a chance to see multiple times called Love After War. And it is Making Love After Making War is the documentary. It's loveafterwar.org. And it's a very, very wonderful, wonderful documentary on veterans and their spouses and sexual experiences after military service. Highly recommend it for both veterans and their partners and clinicians alike to get an experience of what it's like for these couples. And that's about it for the conversation that I want to share with you today. Just a little tidbit, again, I believe that sexuality is a vital element of health and well-being, that sexual expression needs to be valued. Within the VA, I manage the women's program, but I also run something called VA SHIP, the VA Sexual Health Interdisciplinary Program, where we train clinicians. We meet once a month for a community of practice. I train me and our leadership team, we train clinicians on sexual issues and talking to veterans about sexual issues. Once a month we do a training, once a month we do a consultation. So it's a resource. So if you're a veteran listening, feel free to talk to your providers about VA SHIP and say, hey, I heard about this resource. What do you, is this something you can join or get information about? We've got clinicians there who've published resources and materials. One of my really good colleagues, Dr. Ali Kaludas, just published a 32-page guide for veterans on enhancing their sexuality. So that's a free, available, incredible resource. Highly, highly recommend it. So that's about all I've got for today. Thank you so much.
Wow, thank you, Asya. Such good information. I just think to myself, what an honor and a privilege it is for us to be able to work with these vets on these challenging things. It's like people come to us and they talk about these very intimate things that nobody wants to share with others. And we realize that. And if you're out there, whether you're a veteran or just a person struggling with sexual dysfunction, I get that these are really difficult things to talk about. But what we find is when we do talk about it, acknowledge it, it can be life-changing, absolutely, for you. There's no doubt about it. I think what I find working with the vets and with people is that it's hard for them to get in touch with their emotions because those are all put aside for war and for combat and for even military service. And so learning to get in touch with those emotions for both that person and their partner, it can be challenging, but absolutely it can be done.
Yes, and I also think when we get those difficulties, we go to basics. Online there's tons of free resources on the emotions wheel. Starting to identify what is it that I'm feeling. Right, I tend to think, and this is my own non-researched theory, but I tend to think that if we look at a globe, then I think at the outermost layer, unless, if someone is really, really disconnected, then I think on the outermost layer is like numbness. Beyond the numbness, I think oftentimes is anxiety. And I think anxiety is protective, and it's protecting what might be the deeper feelings. And then once we get past the numbness and once we get past the anxiety, we can get to the root of what it is that someone's emotional experience is. And I think, at the core, it really is like the sacred space. And once we can get there, I think that opens the door to allow for optimal sexual experiences.
Definitely. And so because often there's one emotion that we see all the time, and that's usually anger, right? That's the one that it's easiest to let out or acceptable for men or veterans or people, anger. So anger comes out, but what's really under it is sadness or anxiety or frustration or whatever. So it's kind of getting at the root, getting down to the root, like we have to do when we're getting rid of a weed or something. So it can be very important. But yeah, I think like even there's the emotion wheel, but there's just like all kinds of things you can find online with just what are all the different emotions? What are they? How can I identify what I'm really feeling? And of course, working with a therapist and a clinician can be really helpful too.
Yeah.
I think too, one of the greatest gifts that we can give another person, especially that person we love so much, is our time and attention. I mean, what greater gift could you give them than your full presence? But it's difficult to be fully present when you've had a lot of traumatic experiences in your past.
Yes. And I think, Jeff, to that point, I agree. I talk to patients about, we schedule everything, schedule sex, prioritize. If that's important to you, find the time for it, find the time, prioritize it. If you've got kids, put a little X on the calendar, something that's, discreet that you can mark off. And again, don't do it as it needs to be regimented and this many times, but do it as this is important to me. Look, it's a priority. I would like us to do this, and then set whatever parameter it is, with yourself or with your significant other or others.
Yes. And so often I know what we're trying to do with our work, whether it's sexual trauma or any kind of trauma, is the thing that happens with trauma is we try to bury it, we try to push it away, we try to not acknowledge it, but it will not be unacknowledged. And so I think first what we try to do is help them acknowledge that trauma did happen. And then two, I think what human beings do and our veterans and our patients do is then they try to figure out, what did I do wrong? What should I have done different? How could, and learning to know you couldn't have done anything different. You did the best you could in that situation, but this happened. But it's not who you are. It's something that happened to you.
Exactly.
And I think when we're able to help them put that into perspective, but it's so hard because it bleeds over into everything. And it's learning to be like, this is something that happened to me, but it is not who I am in any way, shape, or form.
Yes. Yes.
So I think that's so important. And so and then too, I think what's really difficult sometimes is then once we get them thinking about emotions and working on emotions, challenging those negative thoughts and emotions. Because we all have to remember that voice in our head is a culmination of past trauma. And it usually is really, if someone talked to you like that, I say this all the time, you'd call that abuse. But the voice in your head talks that way all the time to you.
Yes.
So I think it's really important for us to challenge that negative thinking and those negative emotions. No, I am more than my dysfunction. I am, challenging those things.
Yes, yes. And I think to your point, we are more than our thoughts, and sort of saying that, using mantras, telling yourself that,
Mm,
we are more than these thoughts. This is not all of me. I'm helping us enliven that, make that real, because if we don't combat that voice, it can get gnarly. I mean, voices can eat us. We don't have to be, psychotic to be hearing voices. We all have a voice in our heads, and if we don't check it, it can really sometimes get out of control. And that is on us, and it is within our control to do something about it, and know that we are our own. We hold our own power.
Absolutely. I think that's so important. And I really do believe in the power of both affirmations, where you affirm what's to come, but even more so, affirmation, what that you believe is present in your life and already formed, but just has to be realized. So, and we do those during our centering exercise at the end, if you've listened before, and we'll do that today, reminding you that you are enough, that you are worthy of love and belonging, but you can do that for yourself. It's powerful, right?
Yes.
So I think it's really good information. Well, I have my first question for you. I thought was a good one. It says, I feel a lot of shame and am often silent around these struggles. How can I seek help or even begin to talk about intimacy concerns?
That's a great question. So, first of all, thank you for sharing it, and thank you for your vulnerability. I think, we have to do a lot of unlearning, relearning, sort of part of the issue is trying to understand, where does the shame come from? What are the roots to the shame, and what will help make you feel safe to start having those conversations. And again, that safety has to start with you first, right? Like, first we have to find safety within ourselves. Sometimes we're not safe to ourselves, and we have to explore that first, to then be able to explore that with somebody else, hopefully a trusted person, a therapist. And when you feel that safety has been established, then we can sort of move further. When it comes to trauma informed care, safety always comes first. Judith Herman writes, a very known book, Trauma and Recovery, has written about, she was sort of the pioneer when it came to veterans and looking at PTSD in combat. But she has different stages of healing, and the first stage is safety, right? So it's safety, remembering, retelling your story, but safety comes first. So, and that can be weeks, months, years, and it's not a linear process. So the first step is to explore in a safe way, what is it that has led to the shame, what maybe it's experiences that have led to the shame, and how can we start to broach that topic. Sometimes, it's okay that we're not going to go deep right into it. Sometimes patients come to see me for sex therapy and we don't touch sex for years because there's a lot of trauma that needs to be reworked, and people have to be pieced back together because a lot of experiences have broken them horrifically. Yet again, I fully believe in the resilience of people and the capacity of people. So it is possible. It is possible, even if we feel broken or damaged. I believe that everything shapes us, and I think there is an ability to rework and flourish despite limitations and experiences.
Absolutely. I think that's great information. And realize too, listener, everybody has shame. Shame's universal. We all have something that we feel that way about. I really like Brene Brown's work. She's a shame researcher. And so it makes us think, I don't want to be vulnerable. I don't want to be sad. I don't want to, but vulnerability is the only path to love and to creativity. So working through that shame and realizing that you are enough, I think is so important. But great. The next question is, what does healthy intimacy look like after service, especially if it looks different than it did before? And how can individuals and couples redefine it in a way that feels authentic and fulfilling to them?
That's a great question. And again, I think I don't want to have a cop out answer, which is it depends. But again, when someone says healthy intimacy and you're talking about sort of what's fulfilling, it's going to be whatever is co-created between that individual and their partner. So it's working together to explore and identify what feels enjoyable. What I tell couples frequently is, the less you engage, I mean, this is like basic math, but the less you engage in sexual experience, the less probability that it's going to be good, right? Because if you're avoidant of it and then you engage in it, you have all these high expectations and it doesn't go well, you think, oh, there we go again. But if you engage and practice and try all different kinds of ways without a goal of just like, I'd like to connect with you, then your chances of being in that and experiencing it are higher. The question also points to, what is healthy sexuality? And again, healthy is, it is based on what feels healthy. But I will tell you, what we want to do is we want to promote pleasure and safety, right? So if you're engaging in an experience that feels safe and you are enjoying yourself, then, and it is, again, free of coercion, it is free of violence. You are focused on well-being. We're focused on positivity. We're not looking at pathology. We're looking at what I am enjoying, what I find fulfilling, what I find joyful, right? Enjoying joy.
It's so funny. Your answer has two things that I so often find are the goals or intentions of my couples with intimacy and sex is, did they feel deeply connected? So if you did, tick the box. You did it.
That's
It
right.
was a success. That was a healthy, intimate moment. And did you have pleasure? Did you have fun? Did you feel connected and didn't you have fun? You did it. I mean, though, and what are your goals and intentions? And usually, for most people, it's feeling connected, feeling seen, heard, valued, and by that other person, and them feeling that way with you without judgment. And so, feeling highly connected and feeling pleasure. Sometimes, too, I find my trauma veterans, it begins with like, can you just experience pleasure in food or doing something pleasurable or a massage? It
Yeah.
starts with small steps, allowing yourself to know that you are worthy and entitled to pleasure or
Yeah.
enjoyment.
Absolutely.
So, whatever it is for you that helps you feel more healthy in that relationship, to feel deeply connected and loved, I think those are the answers. So,
Yes.
yeah, I think it's so, so important. And so, speaking
Just
of
one.
that,
So,
yeah,
so,
go
so, so sorry, Jeff. Just one quick thing. For the first listener, and also for this one, I was, the first question was sort of how do I broach this? What we say, sex or not, a therapist will say the only way out is through. Like,
ahead.
if we avoid it, if we don't address it, it's not going to magically heal. It's not going to go away. As a matter of fact, I also, will say, if we sweep dust under a rug, it's just going to sit there under the rug, and maybe more will accumulate, right? Like, we have to go there. We have to address it. And it can be slowly. It can be baby steps. We can slowly step in, again, when it comes to trauma, and it comes to, when it comes to this work, safety first. But I think starting the conversation, going there, giving yourself permission to say, I can do this, like, yes, it might look different, but I am, to your point, I am worthy of this. I am worthy of a new experience, of a reworking experience, of a better experience.
Definitely. Well, I'm going to come back to you in just a minute, but this is a perfect time to do our closing centering exercise, which goes right where we're talking about. So, as we begin our closure of today's episode, I invite you to take a moment to reconnect with yourself, with your body, and your sense of safety. You've heard that word over and over, your sense of safety. If you're able, find a comfortable position, sitting or lying. If you're sitting, put your feet flat on the floor and get comfortable. Find a place to rest your arms. Gently close your eyes or soften your gaze, whatever's comfortable, and take a slow, deep breath in through your nose and exhale gently through your mouth. Again, inhale, exhale. In your nose and out your mouth. Continue that breathing and bring your attention into your body. Not to change anything, but simply to notice. Keep breathing. Notice where your body feels supported, where it feels tense. Where does your body feel at ease? There's no right or wrong here, just the awareness. If it feels comfortable, place your hand over your heart or somewhere else on your body that feels grounding, your heart or your abdomen or your solar plexus. Feel the warmth of your hand, the steadiness of your breath. Remind yourself gently, I am here. I am allowed to feel. I'm allowed to feel. I am allowed to reconnect at my own pace. I am enough. I am worthy of love and belonging, and I am worthy of pleasure. For those of you who have served, coming home is not just a place, it's a process of returning to your body, your relationships, and your sense of self. Take one more slow breath in your nose and exhale fully through your mouth. When you're ready, gently bring your awareness back to the room, back home. Well, Vic, can you tell us what's up next week on Dr. Jeff Talks about sex and intimacy?
Pelvic floor muscle exercises, often simply called Kegels, are commonly recommended, but they're also widely misunderstood. Who actually needs them? When are they helpful? In this episode, Dr. Jeff is joined by internationally recognized pelvic floor expert Diane Newman to unpack what the pelvic floor really does. She discusses how targeted exercises can impact bladder and bowel control, sexual function, recovery after surgery, and overall quality of life. Join us on March 31st at 7 p.m. Central Time to learn more.
Vic, thank you for those crazy ticklers. But I'm really excited to welcome Diane Newman because people ask me all the time, how do I do my Kegels right? Am I doing enough Kegels? So we're going to answer all your questions about that next week. But this week, Asya, you're one of my favorite people. I just enjoy every time we get together. It's just such a pleasure. I've seen the amazing work that you've done with patients and veterans in your private practice as well as at the VA. And I know the wonderful work you do. And I so appreciate all you do to make the world a little better place, definitely. And
thank you so much. I feel the same way. I really do feel the same way, Jeff. It is an honor. It is an honor, and it's incredible. We're lucky. We're lucky that we have people within the VA system that can prescribe medication and do sexual medicine and can do the talk therapy. It's rare, and we want veterans to know, like, it's out there. It's available. Ask for it. You don't know until you know, and you won't know until you ask.
And I love the women's program and the newsletter that comes out and all the great things. I really enjoy working with our women vets. Sometimes I think don't you think sometimes you're like, gosh, they get pushed into the background. They're a little forgotten, but they're struggling and they need a voice. And I love how you've given them a voice and places to heal. So it's really, I love the vets, and I'm so excited that I'm honored and privileged to work with them, and I know you feel the same way. I just wondered if you had a closing thought, and I'll give my closing thought to listeners as we finish this episode together.
I think my closing thought is, don't be afraid to believe that that reclaiming is possible. It's possible. It's doable. It's not rocket science, and you can get there. You can.
It's so true. I guess that's the biggest, most important thing that I want to tell our vets and all of our listeners, because wherever you've served, and you've served somebody in your life, that's for sure. So whoever or whatever you've served, you deserve love and belonging, and there is hope. Everybody is worthy of this, and you are too, listener. So there is great hope. If you in particular are looking for Reclaiming Pleasure, we did an amazing episode with the author of the book, Reclaiming Pleasure, Holly Richmond. So look back at that episode. We have so much good information to share, and we're just here to help you because you are amazing and miraculous. Thank you for joining us, and have a good one.
Who's Dr. Jeff talks about sex and intimacy, breaking down the science, setting your spirit free with stories, wisdom, laughter, and care. Connection.